Hey guys, it's Dr. Smash Gonzalez. I'm going to show you how to resolve and decrease pain with some knee symptoms you might be having, especially runners. Sometimes skin rolling, this really simple technique that I'm going to show you today, can help out with that. And all it is simply pulling up the skin and you go through it like you're rolling. Simple stuff, right? And the basic premise of this is they're not really addressing tissues like muscles and tendons and so on. All we're doing is we're creating a bigger tunnel for subcutaneous nerves or nerves that come into the area right underneath the skin to kind of pass through. And a lot of times with conditions like patellar tendonitis or just the wear and tear that you get from running, you'll get some irritation in these nerves, and you'd be surprised how quickly, I'll do it with one hand so you guys can see, how quickly the symptoms can decrease, at least for a couple hours, even a day or so, while doing something like skin rolling. So I like to typically start again at the inner part of the thigh, just because I know which nerve I'm looking for is mainly the infrapatellar nerve, which comes down and tracks this way. But you have some other ones that kind of pop out different sections too. So don't be frivolous with this. Just kind of find other spots. You can also go in the inner adductor, roll the skin up into there. You can go into the quad area right here, roll it all the way over the cap, kind of grab it and pull it around. All right. Sometimes they're a little sensitive, and you might notice doing the other side, it's not quite as sensitive. These will diminish typically. Okay. Another thing you can do is also get a suction cup, and I've been surprised when you end up doing something like this to people and have them run right after, even with the cup on them, they're like, oh, the pain went away, right? It just blows their mind. So simply put, sometimes these nerves can just be hypersensitive, and they're creating the sensations that you have when you're experiencing runner's knee or patellar tendonitis or jumper's knee or medial meniscus tears. Sometimes the actual structure that you're thinking is actually not the one that is creating the pain. It's actually the nerve. So use this suction cup as a handle. We're not trying to pull blood or suck chi or anything like that. We're not trying to get trying to do any acupuncture. We're just simply trying to lift the skin. And sometimes in areas where the skin is a little bit more matted down and fixated, that's where the problem is, and you just have to lift it with the cup. You can use bigger cups. These things are cheap. You can get them on Amazon for like $5. Now, if you guys are looking for more information on runner's knee and ways to decrease pain associated with it, I've created a little video guide for you guys as well. You'll find it in the corner right there. It's pretty cheap. It's digital. I put that out. I put it out there because I've had a lot of people ask about how to resolve some of these types of conditions, and since I can't honestly, I can't examine you guys because you're not here. I can't fly there, and I can't do anything on the phone. So a lot of times, just guiding you through an educational process of how to deal with these things and how to manage your own type of rehab is probably one of the best things we can do. So check those out. I've tried to make them very concise and to the point, and they're basically all videos that you're going to find on YouTube or that you won't find on YouTube. So if you like this, share with a friend, and I'll see you guys next week.